Listen, if you're watching this right now, there's something I need to tell you. Vision loss is one of those things that sneaks up on you. You're reading the menu at a restaurant and the text looks blurry. You're watching your grandchild play and the faces get a little fuzzy. You tell yourself it's just getting older. Maybe you need new glasses. But here's what most people don't realize. A lot of what we think is permanent vision decline can actually be improved. Your eyes have muscles, just like every other part of your body. And those muscles can be trained. They can get stronger. And that's what we're talking about today. My name is Dr. Ryan Carter. I've spent 7 years in clinical medicine, working directly with patients, understanding their fears and their health challenges. And I'm going to be honest with you. Doctors today don't have enough time to really explain things clearly. We're rushed. We're overwhelmed. So I started this channel to give you the detailed, honest information that could genuinely change your life. Because you deserve to understand your own body. You deserve clarity. And you deserve to know that there are real, science-backed things you can do about problems like this. That's why I'm here. Now let me explain what's actually happening with your vision. Your eyes work through a series of muscles and structures. The lens in your eye changes shape to focus on objects near and far. The muscles around your eye control that focusing action. And here's the thing that most people don't know. If those muscles aren't being used properly, they weaken. Just like your legs weaken if you don't walk. Just like your arms get weak if you don't use them. Your eye muscles are no different. When we spend most of our day looking at screens, our phones, our computers, our tablets, we're not using the full range of those eye muscles. We're just using the close focus muscles and the far focus muscles. They're sitting idle. That's part of what's happening to your vision. But here's where it gets important, because that's also the part you can actually do something about. I've seen this so many times in my practice. Patients come in thinking their vision is just getting worse because they're aging. And yes, age is a factor, but inactivity is a bigger factor than most people realize. And that's the good news, because inactive muscles can be retrained. Let me tell you about a patient I worked with a few years ago. Her name was Margaret, and she was 67 years old from Tucson, Arizona. She was a retired librarian, and she loved reading. But over the course of about 2 years, she noticed that reading was getting harder. The print wasn't clear anymore. Her eye doctor gave her new glasses twice. Still struggling. She was convinced she was just going to have to accept worse and worse vision as she got older. But one day, during a routine checkup, I asked her about her daily habits, and we talked about the fact that she wasn't doing anything specific with her eyes. No exercises, no deliberate eye movements, just reading and watching TV and occasional walks. That conversation changed things. I taught her 3 specific eye exercises, and I'm going to show you those same ones in just a moment. Within 6 weeks, Margaret came back and told me she could read again without straining. Within 3 months, her eye doctor actually found that her visual acuity had improved. She didn't need the latest pair of glasses. She needed to use her eyes properly. That's what changed things for her. So, let me break down the 3 exercises that actually work. And I want to be clear here. I'm not saying these are a cure-all. I'm not saying you'll never need glasses again. But research shows that specific eye exercises can improve focusing ability, reduce eye strain, and actually improve visual acuity in many cases. These exercises work because they retrain the ciliary muscles in your eye. They make those muscles more flexible and stronger. The first exercise is called accommodation training. Here's how you do it. Hold your finger about 4 inches from your face. Focus on your finger. Really look at it. See every detail. Now, keeping your finger in place, look past your finger to something far away, something across the room. Really focus on that distant object now. Then look back at your finger, then back to the distant object. Do this 10 times. Slowly. This exercise trains your eye's ability to switch focus between near and far, and this is exactly what weakens when we spend all day looking at close-up screens. Margaret did this exercise 3 times a day, morning, noon, and evening, just 1 minute each time. That's 3 minutes total per day. The second exercise is palming. This is actually a relaxation exercise, but it's incredibly important because stress and tension make vision worse. Here's what you do. Rub your hands together vigorously until they're warm. Now close your eyes gently and place your palms over your eyes. Don't press hard, just let them rest there. The warmth will relax your eye muscles. Your eyes naturally start to relax. Stay like this for 2 minutes. Let your eyes rest completely. Margaret did this after she worked on her computer each day, just 2 minutes. It made a huge difference in her evening vision clarity. The third exercise is eye circles. This trains the muscles that control eye movement. Here's how. Look straight ahead. Now slowly move your eyes up, then to the right, then down, then to the left, and back up. Make a big, slow circle with your eyes. Do this 5 times clockwise, then 5 times counterclockwise. That's it. 1 minute of work, and you've trained all the directional eye muscles. Margaret did this every morning as part of her routine. Now, I want to be very clear about something. I'm not diagnosing you with anything specific. I can't do that through a screen. But I can tell you what research shows and what I've seen work with many patients. These eye exercises are supported by scientific research. They're not a substitute for proper eye care. If you have serious vision problems, if you have certain eye conditions, you absolutely still need to see an eye doctor. Your ophthalmologist or optometrist needs to know about any vision changes you're experiencing. That's critical. Here's what you need to do starting today. First, understand that your eye muscles are just like any other muscles in your body. They respond to use and training. Second, commit to these 3 exercises. Just 5 to 10 minutes per day total. That's not much. Third, be patient. Most people see improvement within 4 to 6 weeks if they're consistent. Margaret didn't see dramatic changes overnight, but over time, real change happened. And fourth, if you're doing these exercises and you're not seeing any improvement after 8 weeks, or if your vision is getting worse, talk to your eye doctor. Get a professional assessment. There might be something else going on that needs attention. But here's what I know about you if you watched this far. You care about your health. You're willing to try things that might actually work. You're looking for solutions, not just excuses. That matters. That's the kind of person who succeeds with this. Because these exercises only work if you actually do them. And most people won't. Most people will tell themselves they don't have 5 minutes. Most people will start strong and give up after 2 weeks. But you're here. You're learning. You're taking control of your vision instead of just accepting decline. You've already won half the battle. Your body, including your eyes, responds to what you do with it. If you use your eyes properly, if you train those muscles, they get stronger. If you let them sit idle, they weaken. You have power here. You have the ability to improve your vision without waiting for new glasses or surgery. That knowledge, what you just learned, that's your greatest tool. Don't waste it. Start these exercises today. Commit to 5 to 10 minutes for the next 6 weeks. See what happens. I think you'll be surprised. Thank you so much for watching this. You took time out of your day to learn something that could genuinely improve your quality of life. That says something about you. If this was helpful, a thumbs up means the world to me and helps other people find this information. And if you know someone, a parent, a friend, someone you care about, who's struggling with vision problems, please share this with them. You might help them see better. You might help them avoid unnecessary prescriptions. You might genuinely improve their life. That's what sharing does. Finally, if you want more detailed health information like this, subscribe to the channel. I'm creating new videos every week, covering topics just like this, things doctors don't have time to explain clearly. I'd love to see you back here. Thank you. Take care of yourself. Your eyes are listening.